Welcome to the Teaching Value in Healthcare Learning Network. Join us to hear leaders in the field share practical and tangible advice about how to best develop engaging curriculum and health system innovation to train a new generation of healthcare providers from diverse specialties. I am Arjun Gupta, a fellow with Costs of Care, and I'll be moderating today's webinar. Today, we will share an innovation in engaging our youngest medical professionals, medical students, in value-based care. This past academic year saw the launch of the US Choosing Wisely STARS program, or the Students and Trainees Advocating for Resource Stewardship program. Here to speak about this are Chris Moriates, a director at Costs of Care, along with Will Squires and Zack Timmons, who are both students at Del Med and also their STARS representatives. Welcome, guys.
Thank you, Arjun. Appreciate it. So yeah, this is it's fun to be on this side of the camera for this webinar this time. I'm going to tell you a little bit about how STARS came about. It actually started in Canada, from Choosing Wisely Canada, where they sort of realized that for their medical education strategy, that while there's a lot that can be done sort of top down and, creating different learning objectives and getting pushed out and creating different sort of, regulatory or calls from medical education leaders to say we should integrate this into our curricula, that really having a bottom-up approach, getting the medical students engaged in doing that work could be really effective. And it really comes about by realizing that that is actually sort of embracing the principles and ideals of the Choosing Wisely campaign in the first place, right? Really supporting a groundswell of leadership and using that to drive this campaign. And so I actually was lucky enough, along with the rest of the Cost of Care directors, to be on the advisory board for Choosing Wisely Canada STARS. And the name, by the way, came from a student in Canada who came up with this name of STARS, for Students and Trainees Advocating for Resource Stewardship. And so what Canada did was they got 2 students from each of the 17 med schools around Canada. Kind of easy because they only have 17 schools across all of Canada. They know them all. They know all the folks there. And they got the deans at those schools to select 2 medical students who they sent to Toronto that first year. And they taught them about choosing wisely. They taught them about leadership and advocacy. And then they sent them off to their medical schools to implement kind of programs related to that. And at the end of that first year, I was hearing a report from Brian Wong and Karen Bourne, who helped lead the effort there. And they're telling us about all the amazing things the students had done. They started Choosing Wisely interest groups and journal clubs, and they had worked with their national organizations. They'd come up with a top 6 list of what medical students should do to consider choosing wisely. And it was really amazing. And I thought, we should totally steal this idea. Right? We need to do this in the US. And for me, I recognized that it actually brought together sort of all my different jobs and roles. It was like, this was Cost of Care, this was Choosing Wisely, this seemed to fit really well with my new charge as an Assistant Dean for Healthcare Value here at Del Medical School. So we pulled together a coalition of the willing. We found amazing support, once again, from the ABM Foundation, the Macy Foundation, Cost of Care, and we were able to pull together this program, Choosing Wisely STARS, where we recruited, we sought to recruit 20 medical schools. That's the amount of funding we got, but 25 responded and we couldn't turn them away. So we decided to stretch the dollars a little bit, and we brought 25 medical schools in, 50 medical students. And what we did was we actually recruited faculty mentors at each of those medical schools and asked them to get the support of a dean or chair level, leader. So a lot of these were like the dean of the medical school or the dean of curriculum, who said, yes, we will help support these medical students here. And they selected 2 medical students from each of their schools. We let them select based on any way that they wanted. This is part of the program, I think, which is allowing that flexibility for folks to innovate locally on how they implement it. And we brought those students to here, Austin, Texas, in December of this past year. And all 50 students came, and we taught them about choosing wisely. We taught them about advocacy. They went out to a barbecue dinner that we paid for, and then sent them on their way. And as we'll talk about, they're off doing things at their medical schools just as we had hoped, implementing choosing wisely. So since this is a medical student led effort, I thought it would be silly for me to do all the talking. So I brought our two medical students here, our Del Med STAR students, so maybe they can talk a little bit about their experience.
Yeah, so as Arjun mentioned at the start, my name is Squires, and this is my friend Zack, and we got involved with STARS from Dell Medical School. It was pretty awesome when we heard about the program first, because Dell Medical School as a whole is already really invested in this idea of value-based care and the importance of that. So that's kind of why I came, part of the reason why both of us came to Dell in the first place. So it was just another chance, another opportunity to really put that into practice. So it was great. The conference in December was awesome. A lot of leadership coaching that we get through Dell. We got re-emphasized at the curriculum and then even expanded at the conference, which was really awesome. And as a medical student, you're kind of isolated from the rest of the world. You're stuck in your bubble studying all the time. So it was really awesome to kind of experience an event with so many medical schools from across the country. So that first kind of conference was really awesome. So do you have anything else to say?
Yeah, I mean, I think that was great. I mean, I think going off the work we've done here at Del Med, kind of the first thing when you think of healthcare value as a medical student, it's where do I fit in this? And I think to Chris's point, one thing that we feel very strongly about is kind of starting this idea of healthcare value and learning about it early and kind of setting that paradigm for the rest of a medical career. So that was something that Will and I were really passionate about, really excited to be part of the program. And kind of how we broke it down here at Del Med, specifically with Choosing Wisely, was kind of in 3 different buckets. So the first being general awareness. What is Choosing Wisely? How can we educate our peers about what Choosing Wisely is as a resource? The second was preclinical curriculum. So even before we get into the hospital, how do we get students involved in choosing wisely and value-based care through our case-based learning, through our lectures and that sort of thing. And then looking to the future for us, the clinical environment. So how do we get clerkship directors involved and tell them a little bit more about choosing wisely and get that involved. So we have that continuity throughout the whole process. And so that's really what we've been focused on for the past, oh man, it's been, I guess, 7 to 8 months now.
Yeah.
And so we've kind of done little projects throughout this whole time that have addressed those 3 things. So the first thing was we had a kind of kickoff lunch where we brought everyone in and taught them about choosing wisely. Will and I have been really active in getting Choosing Wisely recommendations implemented in our cases. And I think to your point, I think Arjun, we were talking a little bit about this before, but you can really take this idea of choosing wisely and integrate it however you want in the curriculum that's already set. And so I think that was a big help for us when we went to our curriculum directors and didn't tell them we wanted to create an entire new program, but just kind of add in one learning objective here or different things like that. And same thing with the clerkship directors, you know, they're all focused on evidence-based medicine. And so I think value-based care is a really natural thing to get involved in. So it's been great so far, great responses from everyone across the board.
Well, that's fantastic to hear, and I didn't expect anything less from Del Med, but I served as the faculty mentor here at UT Southwestern, and I can tell you that it's really, really hard to get investment from every single person because there's a lot of competing interests in the curriculum. And so, for example, the class size at Southwestern is 230 or something like that. And so to even get 100 students at one time for one place for an hour is really, really hard. And I think it sort of comes back to you having excellent leaders at Del Med. Chris is there. I know Dr. Johnston's very supportive of all of this, and it's a relatively new school. And so you maybe get to direct some of this. But perhaps, Chris, for some of our other medical students who may watch this, who may not have that supportive leadership or a more set curriculum, how do you think they can work towards that?
Yeah, thank you. I mean, that's obviously one of the major challenges. And yet I think one of the really unique opportunities for STARS, because it turns out we've seen that it is generally, not everywhere, but it's sort of harder, I feel like, for some of the curricular leadership to say no to the students themselves, to come in and say, this is important to us, and we want to integrate this into our curriculum, rather than, you know, this sort of like top-down effect, as we've talked about. You know, the first-year student saying this is interesting probably does more than the ABIM Foundation saying that they need to be doing this, is the point. And, oh, excuse me. And I think what we've noticed is that students have been most effective at trying to not create a new course or but actually integrate into what's already going on. So as Will and Zach mentioned, implementing choosing wisely learning objectives into the cases that already exist. We've heard from students who've implemented it into their standardized patient encounters. So going to a course director and not saying, I want to start a healthcare value course or choosing wisely, but rather say, hey, can we figure out how to add this in? Similarly, in Canada, I know that some of the most effective initiatives were where students went to their course directors and just said, do you mind if before we have a lecture, we email the faculty and just let them know that we're focused on choosing wisely. So if they're going to be talking about cardiovascular, we want to send them the choosing wisely list and just ask them to put that up as part of the lecture or to address the 5 things that should be avoided. And so I think those are the ways that you can sort of implement it in. I also think that having this sort of process, so you might feel like you are the only med student who cares about this or the only junior faculty member who cares about this at your organization. But having this sort of almost support group of 50 other medical students, 25 other faculty across the country who say this is important, I think there's a little bit of it helps kind of lift everybody up. And you can always, I think it plays well to be at UT Southwestern and say, well, look what they've been able to do at Del Med, right? You guys don't want to be second fiddle to us on anything. And so I think you can get a bit of that friendly competition going. And then last thing I'll say about it too is that the students have also, we found, incredibly ingenious in figuring out how to do things even outside of the curricular structure. So I know there are students who are working on creating their own podcast series actually for medical students talking about choosing wisely. And they've been working with students at other schools to try to get this off the ground. And so I think that there are ways that you can sort of work within and outside the curriculum. But certainly this is a barrier that we would hit in any sort of curricular change is there's crowded curricula, it's tough to get in, it's tough to do. And so we're trying to figure out how to sort of weave it into everything we do.
Fantastic. And I think it's easy to forget that it's the program's really been alive for only 6 months or so. I know Canada started a couple of years ago, but our first set of US stars only started in December. And so could you tell us some of the things that they've managed to achieve in just these short 6 months?
Sure. Do you guys, I've got some, so we actually recently reached out to the students to get sort of a 6-month pulse check and see what they've all done. And so I've got some summary data, but I don't know if you guys want to share any of the stories that you've heard from your colleagues, what folks are up to.
Yeah, so I think one thing that Chris mentioned was the podcast, and I thought that was just a really interesting and unique way to get the curriculum out there. I think especially our generation, we're all listening to podcasts, and it's super cool to get the information out there in a new way. But I think even just here at Del Med, we've hosted lunches with, I guess, 60% of our student body, so a lot of people know about the program. And we've personally created 12 different cases that run the length of our longitudinal first-year curriculum. So I think, it's only been 6 months, but the students, I think, to Chris's point, they really understand where those spots are that the curriculum might be tweaked or changed that could implement the ideas. So I know here at Del Med it's been really successful that way.
And they created a Facebook group for us where, all the different STARS representatives are involved, and about every other week or so, you'll see a new picture up there about a lunch that they had or a journal club. So it's clear that people are active pretty much all across the country in these different 25 schools.
We also host about once a month or so just a voluntary check-in call where we allow, the students can call in, they can talk to each other, talk to us. We've had variable attendance at that. Medical students are certainly a busy group. But I know that we've always had at least one school call in, and we're able to sort of share examples and counsel them about what others have done. So at 6 months, like I said, we sort of formally reached out. We found that 40% of the schools had already implemented curricular changes successfully. 87% had really clear plans of what they were going to do to change curriculum, which is actually the big lift. So I know I framed this a little bit as it's all about changing curricula, although that really is not necessarily the ask. When you look at Canada for that first year, most of the students did not actually change curricula. They did things like start an interest group or start a journal club, which are very important efforts, but changing curriculum is a big deal. So that's actually, I think, quite impressive. One thing that we didn't specifically ask for, but came out spontaneously just when we asked for people to tell us what they've done, is that at least a third of schools reported to us that the students themselves had met with either their dean or their dean of curriculum or like a very high level curricular committee to present to them their ideas and what they wanted to do, which was really, I think, impressive, right? That this is serving as a catalyst for first year medical students to be able to present to their dean or their curricular committee is really giving them leadership experience that I think most medical students would not necessarily get. And so even that was, I think, a really amazing thing to see. We've seen a quarter of the schools perform local needs assessments to dig in and say, well, where can we add this in, or what is most needed? Some of them surveyed their student bodies or looked through their curricula and identified opportunities. And then, as mentioned, we've seen a number of really interesting things. So some of the schools have started electives. I know in University of Chicago, they've started an elective where they're putting together sort of value on the fly, brief like handouts and stuff that will teach medical students about topics. And then they've also created what I thought was really cool, a community grand rounds, where it's going to be in the community to teach them all about choosing wisely and how you can partner with your health team to get the best care from your health team. And so I think that's actually really cool as well. So there's been all these really great sort of ideas that come from the students that we wouldn't think of that go outside of just curricular change or adding a course or adding learning objectives.
Great. And so where does STARS go from here? So your students are about to graduate, and I hear that there's some plans to expand potentially.
Yeah, absolutely. So, as I mentioned, in Canada, they were able to start by getting all the medical schools. So here we had to figure out what was the right scope. And like I said, we started with 25 schools. We made sure that they were really diverse. So they covered all the regions of the US. There was a really good mix of public and private and school size and curricular models. So we made sure that it was representative of lots of models, but we certainly want to grow it out to involve other schools. So we are going to be repeating the program this year, and our goal is to actually increase to 40 medical schools. And so we're hoping that almost all, if not all, of the original 25 schools will re-up. They have to commit that they're going to continue to provide that local support for their students. But assuming they will, we're inviting them all back to send 2 new first-year medical students who then will have the opportunity to work with sort of the now second-year students who've done this. And then expand from that and bring in 15 new medical schools who will also be able to benefit from the experience of this first year from the schools that we've had. And so we're looking to do that. And so if you are at a medical school that has not participated and are interested, we'd love to hear from you. We're putting up the website, which should be up very soon. It will be on the DelMed website, but we'll have a very simple, basically application that just says you're interested, who your faculty mentor will be. And faculty are encouraged to apply on behalf of their schools. We'll be sending out more information. We'll send it out through Cost of Care and HVPAA and Choosing Wisely and all of these channels that we can. But we're hoping to recruit schools and continue to grow the program and build even a broader foundation of medical students leading the change that we want to see in medical education.
Great, and we'll post that link on the Learning Network as well. So that's all the time we have this month. Thank you, Chris, Will, and Zach. Thank you so much for coming, and we'll see you next month.
Thank you.
Thanks so much, Arjun.